Hello and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. And just a FYI, today's video has information regarding doctors, physicians as well that are remote. This first company is with Optimal Care. This is a quality assurance nurse. Now I always go straight to the qualifications or requirements. And even if you don't meet every qualification, I still suggest you apply. This job requires you to have a graduate of accredited diploma, associate, or bachelor's degree, School of Nursing, current state license as an RN, at least 3 years of healthcare management, and 2 years of hospice care experience, demonstrated interpersonal skills with the ability to communicate effectively, exhibit working knowledge of regulations and reimbursement at home healthcare. I'm going to skip some of these bullet points. And if you do happen to have a BSN, that is preferred. Also right here, this is very important where it says Microsoft Office skills preferred. Make sure on your resume you do add any platforms or software you're familiar with, including Microsoft Office, Epic, Cerner, Meditech, Protouch. This makes your resume look more tech savvy. Also, this location, this is a remote opportunity for those who live in Michigan, Ohio, Indiana, Mississippi, Texas only. Also, this is actually per diem hours based on department needs in agreement with the supervisor, and the pay range is $36 to $42 per hour. Next job, this is with Commence. Job is a nurse educator review coordinator. This is full-time, and it says Las Vegas, Nevada here. The qualifications include, of course, graduate from an accredited school of nursing and a current license as an RN, or you can be accredited as a health information management professional, that is RHIA, RHIT, CCS, with requisite coding experience, skills, and knowledge. I'm going to skip this information here. And the salary is $93,000 per year. Next job is also with Commence. This is for LPNs, PRN, but it says actively working as an LPN. This job is fully remote. They want you to have an active, unrestricted U.S. license or certification, registered or licensed, with at least 5 years clinical experience in your specialty, and you're currently practicing and seeing patients on an average of at least 20 hours per week. These are preferred qualifications, but they are not required. And this job is fully remote. It is contract-based, 1099, per case pay ranging $100 to $340, depending on case complexity. Most cases take 1 to 3 hours to complete, and charter reviews may take less than 1 hour. Next job is also with Commence. This is a physician peer reviewer. This one's also fully remote, and the requirements are active, unrestricted U.S. license as a MD or DO, board certified in your specialty by the ABMS or AOA recognized board, at least 5 years clinical experience in your specialty, currently practicing and seeing patients an average of at least 20 hours per week. This is also fully remote, contract-based, 1099. Pay per case pay ranging from $100 to $450, depending on case complexity, and of course, most cases take 1 to 3 hours to complete. Charter reviews may take less than 1 hour. And next job is also with Commence. This is an actively practicing physician's position, fully remote, state of Maryland. This job is also contract, 1099. You must hold an active, unrestricted U.S. license as an MD, DO, or PA, board certified in your specialty by the ABMS or AOA recognized board within the state of Maryland or surrounding states, at least 5 years clinical experience in your specialty, post-residency or fellowship, and currently practicing and seeing patients on an average of at least 20 hours per week over the past 30 days. And this is also, of course, fully remote, contract-based, 1099. Next company, this is Newport Healthcare. This is a utilization review specialist or UR nurse. This is also full-time. And the qualifications, 2 years of work experience in behavioral health field, active license or credential in the behavioral health field preferred, bachelor's or master's in behavioral health related specialty preferred. And that's all we have for this job. Next company is Mercalis. They're looking for a patient support nurse. This is only one position available, one opening. The shift is the weekdays, Monday through Friday, from 8 a.m. to 5 p.m. Eastern Standard Time. Qualifications: associate's or bachelor's degree in nursing with valid nursing license in 1 or more states, 4 or more years nursing experience, prior telephonic experience of plus, 2 or more years of psychiatric therapeutic area experience. I'm going to skip down some of these bullet points and go straight here where it says you must be eligible to obtain licensure in all 50 states. I'm assuming that they will actually pay for all these licenses, but if you are so fortunate enough to get an interview, that's a question you can ask during the interview process. And that's all we have for Mercalis. Next company, this is with Accent Care, looking for a triage nurse, non-exempt. Location is Houston, Texas. This is a virtual position, and it's showing here part-time. Yes, it's virtual, and the coverage is nationwide, and it's remote. The salary is $32 to $34 per hour, dependent on experience, and your schedule will be Saturday and Sunday, 7 a.m. to 7 p.m., and then 1 weeknight from 4 p.m. to 10 p.m. The qualifications here, they have a YouTube channel. The qualifications here are license of practice as an RN in a state of agency operation, and that's the most important qualification. Next position is with Nebraska Medicine. This is a clinical nurse pre-surgical screening. This is full-time. And this one has a $5,000 sign-on bonus. You must meet eligibility. It is 36 hours a week, Monday through Friday, 4 9-hour days, and then 7 a.m. to 5 p.m. The position is actually remote after training. So if you see here, this position offers 3 to 4 weeks of in-person training. That's very short, just FYI. After which you'll transition to a remote role. Occasional on-site presence will be required for mandatory meetings, one-on-ones, and IT support. Just an FYI, I've worked remotely for over 9 years, and all our meetings are done via Microsoft Teams, one-on-ones, Microsoft Teams, and IT support. All you do is call IT from your personal cell phone if you have any issues. You don't want to call them from your phone that's embedded in your computer, because if your computer needs to be turned off and back on, you'll lose the call with the IT person. So it's better to call them from your personal cell phone. Back to the job. The requirements here are at least associates in nursing or nursing diploma, demonstrated effective communication skills, ability to demonstrate initiative, teamwork, and flexibility required, currently licensed as an RN in the state of Nebraska, or current compact license required. Now, the BLS and PALS, I've worked for 3 different insurance companies, and they have never required for me to have a BLS or PALS. Here are the preferred qualifications. Just make sure you do at Epic, Cerner, Meditech, Protouch, whatever platforms you're familiar with. Even if you don't have Epic experience on the job, but you have Epic experience in nursing school, I would still add Epic experience on your resume. And the next job, this is with Emory Healthcare. This is a utilization review specialist, registered nurse. This is a 40-hour per week full-time job, 8 a.m. to 4:30 p.m., starting from $47.40 to $54.95 per hour. This job requires the following. So you must have an associate's degree in nursing, at least 5 years of recent acute hospital experience, or at least 2 years of previous utilization review experience, must have a valid, active, unencumbered RN license, approved by a Georgia licensing board, and must meet all quality and productivity expectations and successfully complete yearly competencies. Now, just an FYI regarding these competencies, you may be using either Interqual or MCG, and every year for Interqual and MCG, you'll take something called IRR, and it's basically a testing to make sure you know how to use either Interqual and MCG. And it looks like here they do use Interqual. Now, if you don't have any experience with Interqual, you can go to the description box below. It'll take you to a website called Cure the Bedside Burnout. Click on the navigation link that says Resume Tips, and go to the very bottom of that page under Resume Tips, and you'll see where you can go to get Interqual certification. Now, I am not promoting them. I'm not being paid by Interqual, but just in case you want your resume to be more marketable and that you have Interqual experience, that's an option for you. And the next position is with MVP Healthcare. This is a professional prospective review RN, and this is available for New York nurses. This is full-time, and the position requires A current RN, New York or Vermont license, at least 3 to 5 years clinical experience that's required. Case management experience, case management certification is preferred, it's not required. And then you must be able to manage multiple tasks in a fast-paced environment, strong clinical knowledge, critical thinking skills, and understanding of medical terminology, procedures, concepts. Ability to work independently to analyze complex medical information, effective communication skills, both written and verbal, ability to work independently and collaboratively in a team environment, proficiency in using computer systems and software for documentation, data entry, and day-to-day work functions. And then preferred job skills, of course, prior utilization review experience and knowledge of government insurance programs, Medicare, Medicaid, and of course you will be working remotely. And the pay for this job is $63,000 to $92,000 per year. And also just make sure that on your resume, you focus on what you did, why it's important, and how it relates to the job that you want.